Welcome to our 5 on 5. We're pleased to welcome Professor Gerald Friedman, an economist at the University of Massachusetts-Amherst. Gerald, good to see you. Thanks for coming in.
Thank you for having me.
All right, so let's start off. You're in town in Southern Oregon. You're talking about health care and the economics of health care, certainly regarding the Affordable Care Act. You're speaking tonight here at the SOU RCC Higher Education Center in Medford. What are you going to be talking about?
I'm going to be talking about where we go after the Affordable Care Act. The Affordable Care Act is rolling, being implemented, and now the question is, what do we do next? Because the Affordable Care Act is not going to control costs, it's not going to cover everybody, so we're going to be making more decisions about health care in the next few years.
Yeah, and this transition the U.S. is undergoing is the greatest in its healthcare history. What do you think, is it a future that is positive?
Well, it's better than it was. The Affordable Care Act is about covering more people, getting more people health insurance, and adding another 20 million people to the rolls of health insurance through Medicaid or private insurance will save tens of thousands of lives. That's a good thing. On the other hand, the Affordable Care Act does not control costs. Costs will continue to rise at an unsustainable rate. So in that sense, the future of American health care is bleak. In 5 years and 10 years, we'll be spending not 18% of our national income on health care, but 22, 25%. We'll be cutting back on everything else, education, summer vacations, student loans. We'll be trying to economize on every other aspect of our economy to find money for health care.
And what would, as an economist, what would you like to see the U.S. do to mitigate those rising costs?
The simplest solution is to go after the things that have been rising in price fastest. Out of control administrative costs, bureaucracy in the private insurance system, and the cost of prescription drugs, which are 40%, 50% higher in the United States than in Europe or Canada.
Wow.
Yeah. I mean, the Veterans Administration, for example, is the only agency of the U.S. government that buys drugs at discount prices because they go to the drug companies and they bargain. And they pay European and Canadian prices 41% cheaper than what you and I are paying and our health insurers are paying. Wow. Now, if we lower the cost of prescription drugs to Canadian prices and control administrative costs the way Canada and Europe and other countries with national health plans do, then we would save nationally $600 billion next year. In Oregon, we would save $8 billion. That's more than enough to provide insurance coverage to everybody, to eliminate copays and deductibles and let people go to the doctor. This is a plan that would save an astonishing 700,000 lives in the United States next year.
Wow, very good. All right, we're going to take a quick break. We'll have much more with Professor Friedman in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Professor Gerald Friedman talking about economics of healthcare. So, Professor Friedman, you were just talking about prescription drugs and the economics of that. How do we as a nation broadly compare to other nations with our new healthcare system?
Not well. We are the only advanced capitalist country where anybody goes without health insurance. There's universal coverage in every other advanced country, Canada, Europe, Japan, Taiwan, Korea. Second, our costs are approximately double what they are in other countries. We spend twice as much for healthcare as do people in other countries. Third, our healthcare outcomes are appalling. We have the 45th highest life expectancy. We have shorter life expectancy than any other advanced country. 44 countries have longer life expectancy than we do. And we are falling further behind, especially for working people and middle-income people. The gap between life expectancy for middle-income or poor American versus a Canadian is 3, 4, 5 years. Yeah.
Okay, all right. And as an economist, I'm curious, what got you interested in healthcare?
Well, you know, it's a big part of the economy.
Sure.
I've been interested in issues of social equity and having a situation where people die because they don't have money is, to me, morally repugnant. And also, quite honestly, my wife got very sick. And we had a health plan, a health insurance plan that we bought because it was cheap. We were advised this is a good plan for healthy people, and we weren't healthy anymore. And I saw what happens. And I have children. I have a 26-year-old who was able to stay on our health insurance because of the Affordable Care Act. Now she's off. She was able to get insurance through the exchange in Pennsylvania where she lives, which is a good thing. And my other daughter's 23. She does not have health insurance at work. Does anybody your age? You know, this is an issue of great importance, growing economic significance, and moral significance.
Yeah, absolutely. All right. Now, you're speaking tonight here in downtown Medford at the SOU Higher Education Center. What time is that?
That's at 7 o'clock, open to all.
Okay,
Welcome.
free to the public.
Free to the public. Come on in.
All right. Great to see you, Professor. Thanks for coming in. Appreciate it.
Thank you very much.
Right. Stay with us. We'll be right back.